The following video goes over the rehabilitation and restrictions after total hip replacement using a posterior approach. Total hip precautions posterior approach. No bending forward more than 90 degrees, no crossing your legs, no twisting, pivoting, or rotating your surgical leg. Performing any of these motions may cause damage to the surgical site and should be avoided until you are cleared by your doctor. The following video goes over daily living activities to avoid after hip surgery using a posterior surgical approach.
If you have just undergone a total hip replacement with a posterior surgical approach, here are some precautions that you are going to want to keep in mind. The first precaution is no bending greater than 90 degrees at the hip. The second precaution, no crossing your legs past midline. The third precaution, no twisting, pivoting, or rotating on that surgical leg. These are all movements that could put the surgical site at risk. Some daily living examples that you're going to want to avoid are: do not bend forward while sitting in a chair. This puts your hip past that 90-degree restriction. The second, do not bend to pick up items off the floor without your reacher. Again, this puts your hip past that 90-degree flexion restriction. Third, do not try to put your socks on without your sock aid. Always have your sock aid handy while getting dressed. Do not wiggle your foot into your shoe. Use a long shoehorn to assist you. And last, when you're standing, do not plant your foot on the ground and twist your hips to pick up any item. This goes against the no twisting, pivoting, or rotating motion that we discussed earlier. Keep these things in mind as you're going about your day-to-day activities.
Use tools to avoid these motions. Do not bend forward while sitting. Instead, use a reacher to pick up items off the floor or help with lower body dressing. Do not try to put your socks on by bending forward. Instead, use a sock aid to help you put on your socks. Do not plant your foot on the ground and twist your hips to pick up any item. Instead, use a long reacher to pick up the item while facing forward towards it. Always face your toes forward toward the item you are trying to reach. Do not rotate your body and keep your legs planted. Do not wiggle your foot into your shoe. Instead, use a long shoehorn to help put your shoes on easily. Exercises should be performed following hip replacement surgery. These movements and exercises will help recover muscle strength and function in your legs following surgery. The following video goes over a home exercise program following hip replacement.
If you have just undergone a hip replacement, the following are some exercises that you can do at home to better improve your strength and range of motion in that new hip. The first one is ankle pumps. Move your foot up and down. Repeat 10 to 20 times every hour while you're awake. This is not only going to improve strength, but also circulation throughout the body. The second one is gluteal sets or buttock presses. This exercise can be done laying down, sitting, or standing. Squeeze the buttock muscles together and hold for 5 seconds. Relax and repeat 10 to 20 times every hour while you're awake. The next one are quad sets or knee squeezes. Laying on your back with your legs straight, push down the back of the knee against the bed. Maintain the muscle contraction in the thigh for 5 seconds. Relax and repeat 10 to 20 times every hour while you're awake. The next one is heel slides in lying. Bend your knee on your surgical leg and slide your heel towards your buttock, keeping your knee pointed up towards the ceiling. Repeat 2 to 3 sets of 10 repetitions twice daily. If this movement is too difficult for you to perform initially, you can use a towel or a pillowcase under your foot to help prevent friction, thus making it easier for the foot to slide. Again, you'll want to do 2 to 3 sets of 10 repetitions. Another option is for you to use a belt, wrap it around the top of the foot. You can then use your upper extremities to help pull that leg into flexion. Again, repeating 2 to 3 sets of 10 repetitions twice daily. The next one is a short arc quad. For this, you can either use a folded towel or a folded pillow. You'll want to place the folded pillow under your knee. Then, laying on your back, you'll want to fully extend your knee. Tighten the muscles on the top of your thigh and straighten your knee, keeping the back of your knee on the bolster. Hold your knee straight for 5 seconds and lower slowly. Repeat 2 to 3 sets of 10 repetitions twice daily. Lastly, the final exercise is the long arc quad, or knee extension in sitting. For this, you can either sit in a chair or at the edge of your bed. Raise your lower leg and straighten your knee until completely straight. Hold for 5 seconds, then slowly lower. Repeat and perform 2 to 3 sets of 10 repetitions twice daily.
Thank you for watching. For any questions or concerns, please contact your doctor or ask your physical therapist.